Men, listen carefully. Dr. Sara here. Aging is not the reason your prostate is growing. This silent habit is, and you need to stop it now, after the age of 60. One of the most damaging yet overlooked habits that silently fuels prostate growth is prolonged sitting combined with physical inactivity. As men retire or slow down, daily movement often drops sharply, and long hours are spent sitting on chairs, sofas, or in cars. This constant sitting places direct pressure on the pelvic region, restricting healthy blood flow to the prostate and surrounding tissues. When circulation slows, oxygen delivery decreases and metabolic waste builds up, creating an inflammatory environment that encourages prostate tissue to swell. Over time, this chronic congestion can worsen common prostate symptoms such as weak urine stream, difficulty starting urination, dribbling, and the frustrating need to wake up multiple times at night to urinate. Many men believe these changes are simply an unavoidable part of aging, but research and clinical experience show that lifestyle habits, especially movement patterns, play a powerful role in how fast the prostate enlarges. Sitting for long periods also causes pelvic muscles to tighten and weaken simultaneously, reducing their ability to support normal bladder and prostate function. This muscular imbalance further disrupts urinary control and increases pressure on the prostate gland. Inactivity also contributes to weight gain and insulin resistance, both of which are linked to higher levels of systemic inflammation and hormonal imbalance, including increased estrogen activity relative to testosterone, another key driver of prostate enlargement in older men. The danger of this habit lies in how normal it feels. Sitting does not cause pain, so the damage goes unnoticed until symptoms become severe. Yet the body is remarkably responsive to change. Even light, consistent movement, such as standing up every 30 minutes, walking after meals, gentle stretching, or simple leg and hip exercises, can dramatically improve pelvic circulation. Movement helps flush inflammatory byproducts, restores oxygen flow to prostate tissue, and reduces internal pressure around the gland. Regular physical activity also improves blood sugar control, supports healthy testosterone levels, and relaxes the nervous system, all of which directly benefit prostate health. Men who break the cycle of constant sitting often notice improvements not only in urinary flow and nighttime frequency, but also in energy levels, digestion, and sexual health. The prostate is not a separate organ operating in isolation. It responds to how the entire body moves, breathes, and circulates blood. Continuing to sit for hours every day sends a signal to the body to slow down, stiffen up, and inflame, while choosing daily movement sends the opposite message: heal, circulate, and restore balance. One of the most common, yet damaging habits men over 60 develop without realizing it is poor hydration timing, and this mistake places constant stress on the prostate. Many older men either drink too little water throughout the day or avoid fluids to reduce bathroom trips, then compensate by drinking large amounts in the evening or at night. This pattern irritates both the bladder and the prostate, creating a cycle of inflammation, urgency, and nighttime urination that accelerates prostate enlargement. When the body remains mildly dehydrated during the day, urine becomes more concentrated and acidic, which irritates the urinary tract lining and the prostate gland. This irritation sends inflammatory signals that keep prostate tissue swollen and sensitive. Then, when large volumes of fluid are consumed late in the day, the bladder fills rapidly, repeatedly pressing against the prostate and forcing it to work harder during the night. This constant stimulation prevents the prostate from resting and recovering, leading to worsening symptoms such as frequent urination, weak flow, and the sensation of incomplete emptying. Nighttime urination is not just a sleep problem. It is a clear sign that the prostate and bladder are under chronic strain. Poor sleep caused by repeated bathroom trips further disrupts hormone balance, lowering testosterone and increasing cortisol, both of which promote prostate growth. Over time, this hydration mistake trains the bladder to become overactive and hypersensitive. While the prostate remains in a constant state of irritation. Proper hydration is not about drinking more water at random, it is about drinking strategically. Steady fluid intake earlier in the day keeps urine diluted, reduces inflammation, and allows the kidneys and bladder to function smoothly without overwhelming the prostate. When hydration is balanced, the bladder empties more efficiently, reducing pressure on the prostate and calming urinary urgency. Reducing fluid intake a few hours before bedtime allows the urinary system to slow down naturally, giving the prostate a chance to relax overnight. Men who correct this habit often notice fewer nighttime bathroom trips, deeper sleep, and improved daytime energy within weeks. Hydration timing also supports better circulation, helps flush toxins from prostate tissue, and improves overall metabolic health. The prostate thrives in an environment of balance, not extremes, and erratic drinking habits disrupt that balance daily. What makes this habit especially dangerous is that it feels harmless and even logical to drink more water at night when there is time to relax. Yet this is exactly when the prostate is most vulnerable. By respecting the body's natural rhythms and supporting hydration earlier in the day, men over 60 can significantly reduce prostate irritation, slow enlargement, and regain a sense of control over their urinary health without medication or invasive treatments. Chronic stress and poor sleep form a powerful but often invisible combination that accelerates prostate growth in men over 60. As life changes with age, financial concerns, health worries, loneliness, and disrupted routines quietly raise stress levels, even when men believe they are coping well. The body responds to ongoing stress by releasing cortisol, a hormone designed for short-term survival, not long-term balance. When cortisol remains elevated day after day, it promotes inflammation throughout the body, including in the prostate gland. This inflammatory state causes prostate tissue to swell and become more sensitive, worsening urinary symptoms such as urgency, weak flow, and nighttime urination. Stress also triggers constant tightening of the pelvic floor muscles, reducing blood flow to the prostate and bladder. Restricted circulation deprives prostate tissue of oxygen and nutrients while trapping metabolic waste, creating an environment where enlargement progresses faster. At the same time, poor sleep amplifies these effects. Many men over 60 struggle with fragmented or shallow sleep, often due to stress or frequent nighttime urination. During deep sleep, the body repairs tissues, regulates hormones, and reduces inflammation. When sleep is disrupted, testosterone levels decline and estrogen activity becomes more dominant, a hormonal shift strongly linked to prostate enlargement. Lack of quality sleep also increases insulin resistance and abdominal fat, further fueling systemic inflammation that directly impacts prostate health. Over time, the combination of high cortisol, low testosterone, and chronic inflammation places the prostate under constant biological pressure to grow. What makes this habit especially dangerous is that stress and poor sleep are often normalized as unavoidable parts of aging, rather than recognized as modifiable risk factors. Yet even small changes can create powerful improvements. Simple stress reduction practices such as slow breathing, light stretching, short walks in nature, or limiting constant exposure to negative news can calm the nervous system and reduce cortisol output. Improving sleep hygiene by maintaining consistent sleep times, reducing screen exposure in the evening, and allowing the body to wind down naturally helps restore hormonal balance. When stress levels fall and sleep deepens, pelvic muscles relax, circulation improves, and inflammatory signals begin to quiet. Men often notice better urinary control, fewer nighttime awakenings, and improved energy as the nervous system shifts from constant alertness into recovery mode. The prostate responds directly to this internal environment. When the body is tense, inflamed, and exhausted, the gland suffers. But when the nervous system is calm and well rested, prostate tissue has the opportunity to stabilize rather than expand. Regularly delaying urination is a habit many men over 60 develop without realizing the long-term harm it causes to the prostate and urinary system. Whether due to convenience work habits, or simply not wanting to interrupt an activity, ignoring the urge to urinate places unnatural strain on both the bladder and the prostate. When urine is held for extended periods, the bladder becomes overstretched and its muscles gradually weaken, reducing their ability to contract efficiently. This leads to incomplete bladder emptying, leaving residual urine behind that increases pressure against the prostate. Over time, this repeated back pressure irritates prostate tissue and encourages enlargement. Holding urine also causes the bladder to signal urgency more aggressively in the future, creating a cycle where men feel sudden, intense urges yet struggle to fully empty when they finally do go. This pattern is especially damaging for older men, as the prostate already tends to narrow the urethra with age. Repeatedly forcing urine past an enlarged or irritated prostate increases inflammation and sensitivity, worsening symptoms such as weak streams, straining, dribbling, and frequent nighttime urination. Delaying urination also interferes with the body's natural reflexes that coordinate bladder and pelvic floor muscles. Over time, these muscles become tense and uncoordinated, further restricting urine flow and increasing pressure around the prostate gland. In addition, retained urine becomes more concentrated, which can irritate the bladder lining and prostate, increasing the risk of urinary tract infections that further inflame prostate tissue. What makes this habit particularly dangerous is that it often feels harmless and even disciplined, especially for men who pride themselves on endurance or control. However, the urinary system is designed to function on timely release, not prolonged holding. Responding promptly to the body's signals allows the bladder to empty fully and smoothly, reducing mechanical stress on the prostate. Establishing regular bathroom habits retrains the bladder to function more predictably and reduces urgency spikes. Men who stop delaying urination often experience gradual improvements in flow strength, reduced pressure during urination, and fewer nighttime disruptions. Supporting bladder health through mindful habits helps calm inflammation, relax pelvic muscles, and reduce constant strain on the prostate. The prostate does not enlarge overnight, but daily behaviors quietly influence its size and sensitivity over time, and consistently ignoring the urge to urinate is one of the most underestimated habits driving that progression in older men.